Hello and welcome to the latest instalment of An Audience With, presented by Cover. Today I'm again joined by Nathan Irwin, Chief Executive of WPA. Hello Nathan.
Hello there.
In our last conversation we spoke about the changes that have occurred in the market as a result of the COVID pandemic over the last 12 months, and no doubt volumes will be a part of this discussion. So Nathan, what are you seeing in terms of volumes changes?
I guess if we wind the clock back 12 months, we saw a real kind of restriction in elective care, but it was really reassuring that critical care, particularly for oncological services, was able to continue. But nevertheless, claims were lower, and that's why in April last year, we rebated 40% of premiums, and we did the same again in June. It was encouraging that in the summer months, claims started to pick up really quickly as customers were able to access the care that they needed. And I think our principle as WPA of freedom to choose, not restricting where customers go to receive their healthcare, really did enable that agility on behalf of ourselves and our customers to access care, albeit perhaps in a different location or with a different doctor than they would have envisaged pre-pandemic. By the autumn time, claims were pretty much back to normal. And since then, we've seen claims continue around the normal level until around 4 weeks ago. Around 4 weeks ago, we started to see those claims pick up, really encouraging to see customers start to access that care, and most importantly, be confident to do so. Increasingly vaccinated customers, lower infection rates. I think people are more confident to go into hospitals now. And really, it's quite a good time to be having some elective procedures. Many people, if you're having a simple procedure that you might previously have needed to take a week off work because you couldn't drive, well, now you can take a day off work, get the surgery, and then you might be working at home. So I think we're going to see strong demand over the next few weeks.
Mm-hmm. And sort of NHS waiting times and missed sort of screenings and testings is quite a topic of discussion at the moment. So from your point of view, are people getting access to treatment at the moment?
Certainly what we see through coming in our data is, yes, they are. We've got high levels of diagnostic procedures coming through. We've got high levels of elective care coming through. So from our experience, customers are able to access that care. I think we've seen that for a little time. I think the capacity's been there for some time. What we have noticed is customers' confidence to go into hospitals has really increased over the last few weeks. So I think that's why we're seeing claims edge above normal now.
Mm-hmm. And sort of that sort of missed screening and missed treatment element is leading some to talk about a possible surge in claims volumes coming down the pipeline. So what are you expecting on that?
Whilst I think that claims are going to be above normal for coming weeks, I don't think there's going to be a surge, or certainly not a surge that's anywhere near the reduction we experienced this time last year. I think that the key reasons for that is we've got a limited number of hospitals. We can't build new ones overnight. We've got a limited number of doctors and nurses, many of which have endured the most difficult working circumstances for the last 12 months, and they're going to be fatigued. They need a break, they deserve a break, and so I just don't think the healthcare provision in the UK can expand to 130 or 150% of normal, because we just haven't got the supply to do so. I think for many patients as well, many of us will be looking forward to the lockdown restrictions releasing, and whilst we'll see some increased demand for healthcare procedures for the next few weeks and months, personally, I just can't see it surging to the extent that it certainly reduced 12 months ago.
Okay, Nathan, thanks very much for joining us.
Thanks a lot, John.